Hello everyone, this is Dr. Wu from Department of Cardiology, the first affiliated hospital of China Medical University. Today we are learning management of hypertension. Before using drugs, non-medication treatment should be done first to treat hypertension, including lifestyle modification first, no smoking, weight control, reduce alcohol intake, decrease stress, sodium control, especially for Chinese people because we are salt sensitive. Our goal of treatment is to prolong useful life by preventing cardiovascular problems by reducing BP to less than 130/80 mmHg. Drugs to treat hypertension include diuretics, beta blocker, calcium channel blockers, angiotensin-converting enzyme inhibitors, angiotensin receptor antagonists, alpha adrenal blocker, and others. Dosage and characteristics of antihypertensives, mainly four types: controlled release, sustained and stable, long half-life, long effect, sustained release, prolonged effect, normal, rapid effect. Diuretics may be indicated in mild to moderate hypertension. It is the first drug for hypertension. It is also treatment of heart failure or kidney disease. Diuretics have few adverse side effects. It can be used with other antihypertensives to enhance effectiveness. Action of diuretics, mainly due to reduction of blood volume through urinary excretion of water and electrolytes. We should pay attention. Electrolyte imbalances may occur, mainly hypokalemia, which could lead to ventricular arrhythmia, and the chance of above situation depends on type of diuretics. Another type of diuretics is potassium-sparing diuretics, which could prevent hypokalemia. It is indicated in mild hypertension and can be used in combination with other diuretics. No supplement taken. Potassium intake is not indicated. Watch for hyperkalemia. Side effects of diuretics. Orthostatic hypotension. We should prevent hypotension when stand up or change position. We may feel dry mouth or irritation, electrolyte imbalance, hypokalemia, and disorientation and dehydration. Implications for use. Optimal time of administration is morning to avoid affecting sleep, and record accurate intake and output. Monitor daily weights. Monitor electrolyte imbalances. Another type of antihypertensives is calcium channel blockers. It is emerged as major drug to treat hypertension. CCB is also used for arrhythmias. CCB is alternative to beta blocker, especially for asthma. Action of CCB. CCB blocks calcium access to muscle cells, reduce contractility and conductivity of cardiac muscle, reduce demand for oxygen, reduce peripheral vascular resistance, thus relax arterioles. Here are some examples of CCB: verapamil, nifedipine, and others. Side effects of CCB, including bradycardia, may precipitate AV block, headache, abdominal discomfort, and peripheral edema. Then we come to angiotensin-converting enzyme inhibitors, ACEI. We can also call them ACE inhibitors. They are mainstay of oral vasodilator therapy and major breakthrough in treatment of hypertension. ACEI is more effective when used with diuretics. ACEI could affect renin-angiotensin-aldosterone system. ACEI inhibit ACE activity, lower AT2 level, and promotes renin excretion. Effect of ACE on the cardiovascular system. Circulatory RAS is short-term, which promotes kidney aldosterone secretion and H2O salt reabsorption. Vasoconstriction and cardiac positive chronotrophic effect and arrhythmogenic effect. Tissue RAS is long-term, which causes renal glomerulus hypertension, vascular thickening, and myocardial hypertrophy. ACEI operates on RAS and kidney systems with very complex mechanisms. Decrease AT2 level, inhibit kinase, and reduce kinase degradation. ACEI reduce peripheral vascular resistance without affecting cardiac output, cardiac rate, and cardiac contractility. Advantages of ACEI: infrequent orthostatic hypotension, lack of aggravation of pulmonary diseases, lack of aggravation with diabetes, increased renal blood flow. Drug interactions. ACEI can be used with diuretics, CCB, and beta blockers. All the above enhance the effects. ACEI can be indicated in hypertension patients with heart failure, post-myocardial infarction, high-risk factors of CHD, diabetes, chronic kidney disease, or prevention of stroke. Angiotensin II receptor blocker, ARB, has similar indication and contraindication with ACEI. Beta-adrenergic blocking agents, also known as beta blockers, could inhibit cardiac response to sympathetic nervous stimulation by blocking beta receptors, decrease heart rate, cardiac output, and blood pressure. Examples of beta blockers with OLOL names: beta-1 blocker, atenolol, beta-1 and 2 blocker, propranolol. We should notice that beta blockers cannot be abruptly discontinued, and check baseline BP before application. Side effects of beta blockers, including bradycardia, bronchospasm, wheezing, diabetic, hypoglycemia, heart failure, edema, and dyspnea. Alpha blockers can be used as alternative if beta blockers and diuretics do not work. Also used to treat mild to moderate urinary obstructive disease, such as benign prostatic hyperplasia. Action of alpha blockers. First, block postsynaptic alpha-1 adrenergic receptors to produce arteriolar and venous vasodilation. 2. Reduces peripheral vascular resistance. Side effects of alpha blockers: drowsiness, headache, dizziness, tachycardia, fainting, and weakness. Alpha blockers can be used with other antihypertensives and can enhance antihypertensive effects. Clinical implications of alpha blockers. Side effects most prevalent with first dose. Instruct patients to lie down if dizzy, weak, or uncomfortable. Client teaching for antihypertensive drugs. Take medication as prescribed. Never discontinue without approval of healthcare provider. Incorporate lifestyle changes, even if medication brings BP within normal limits. Check BP on a regular basis and report significant variations and pulse. Get out of bed slowly. Increase intake of potassium-rich foods, unless taking potassium-sparing diuretics. Weigh regularly and report abnormal weight gains or losses. This is the figure of what antihypertensive drugs can be used together. Solid line means they can be used together. This picture shows the common used combination therapy. So much for today. Thank you.